Hello, everyone. My name is Amel, and I am one of the founders of ScleroCare. And today I'll be walking you through how to use the application, what it looks like, how do you even access this, how do you create an account, and most importantly, what resources are currently housed on the actual website. So it's a jam-packed session, but lots of good materials and information that will allow you to get started with using the website and really become a ScleroCare user. So let's get started today. So when you first get to the website, you should go to www.sclerocare.ca. Very simple, anywhere, wherever you are, whether it's on your phone, your iPad, your computer, type in www.sclerocare.ca on any web browser that you prefer, and we'll go from there. So this is what you should see immediately when you get to that page. You have www.sclerocare.ca, and you have this main page with a DNA strand to indicate that kind of fun, sciencey sort of scope that we're aiming to embed within our mission and our values here at ScleroCare. And you have Unlocking Hope and Health, which is ScleroCare's tagline. So if you scroll down along the page, you'll see a couple of different things. Number one, you have our core values. So that's centered around empowerment, inclusivity, community support, knowledge accessibility. So all of those 4 key values that really make up what we were thinking when we started to actually create ScleroCare and why we wanted to go forth with this. So in terms of empowerment, lots of individuals that we were either speaking to or really when we were navigating the research and looking at the information available, we were hearing that upon their first diagnosis, oftentimes they felt very defeated. They felt overwhelmed with the information that was there. So we wanted to create almost like this central hub of information where they can come, learn in an easy to understand way, and gather more information what ScleroCare is all about. Inclusivity, obviously, this is a safe space. This is a place that recognizes diversity. It recognizes a sense of belonging, or it aims to empower or provide a sense of belonging for those who are affected by scleroderma, whether it be either patients or individuals living with scleroderma or caregivers or family members. All of this information really aims to create this inclusive space, but also empower as well. Next up, we have community support. As you will see later on in this video, we have a number of different methods in which we try to aim that sense of belonging and sense of community through resources such as the forums, or even the ability to create your profile as well. Lastly, knowledge accessibility. I myself, I've gotten a chance to work with a number of different physicians, scientists, researchers. I did my undergrad at Western University in my medical sciences and my master's at University of Toronto in biomedical engineering. And I know that there is a lot of knowledge and information that is out there. But the information that's presented is oftentimes very convoluted, very piecemeal, kind of all over the place. And sometimes you might not even be able to access the new cutting edge research that is available or that is being presented because of paywalls. So we wanted to really champion the accessibility of knowledge, make it easy to understand using simple language, but on top of that, make it so that it's free to access. Anybody could read through this, anybody can create an account and begin looking through the various content that we have available so that they can further empower themselves. They can feel as though this is an inclusive space. And of course, as well, find their community. So that's our core values there. And lastly, we have our team as well on the website. So this is actually always growing. If you'll see there, we have Dr. McLean, who is our principal investigator. And we have myself, of course. So my name is Amel, like I mentioned earlier, and I work as the project coordinator or the manager for ScleroCare. I manage the day-to-day activities. I meet with our team. We discuss creating new content and making the information available on the site as well. Over time, we've had a number of different content developers, consultants as well join us. We have all of them listed here, and there's actually new members that have joined us, so it will be updated on the website as well very soon. But one thing that I really wanted to emphasize here is that when you get to this page, you'll see really the history of what ScleroCare is. And I'll just briefly touch on that right now, but ScleroCare is, or really was created out of my 4th year university, during my 4th year of university. So specifically, I took a course called Design Thinking in Healthcare. I believe that's what the course is called. And really the goal was to create a solution for patients living with a specific type of autoimmune or chronic illness. And the illness that I was assigned was scleroderma, systemic sclerosis. And with that, my team decided to brainstorm a number of different solutions, and we ultimately settled on the idea of an app or a website that creates all this information, because we were hearing from patients that it was hard to find information. It was hard to receive the diagnosis, of course, but then to go out on your own and try to piece this information all together was very, very, very challenging. So that's really what we wanted to do. And since then, we reached out to Scleroderma Canada, obviously an organization in the Scleroderma Society of Ontario. And with that, they've been able to fund this initiative, provide us with the support and guidance, and also allow us to present at the National Scleroderma Conference, connect with patients, physicians, all of their members on their team as well. So it's been an incredible, incredible opportunity where we've really gotten to see ScleroCare come to life, of course, but also work with the community to understand what is it that everyone else wants and how can we make this into real life solutions that actually benefit the community and is what they need. So that's a little bit about ScleroCare. Obviously, if you ever want more information, feel free to go to our website, www.ScleroCare.ca, look through this information here, connect with our team, connect with our social media as well, and look at what we have to offer. Because obviously, we've spent many years creating this and developing it and bringing it to life, but we'd always love to hear a little bit more about your experience and what is it that you would like to see brought to life, really. All right, so how do you actually go about creating an account? So in order to create an account, you can go ahead and click this button over here that says sign up. And with that, you'll be prompted to enter in your first name, last name, email address, and then to create a password. If you already have an account, don't worry, we'll get to the next part. But for this, all you'll need to do is essentially put down your first name and last name, which you can also put down a nickname if you're more comfortable with that. As a reminder, this information, so your first name and last name, will be shown on the profile. So please keep that in mind. So if you're not comfortable, use an abbreviated version, create a nickname, do whatever works best for you. Now with this, we're going to go ahead and I'm going to pretend to create an account. I already have an account. So I'm going to go ahead and pretend to create an account. So I'll do Amel Sassy, obviously my first and last name. And then for my email address, for the sake of this, I'll just keep it as a kind of fake email address. But feel free to put down the email address that works best for you. We do not contact you for spam or additional information or anything like that. This is just to create an account. So you will not receive emails from us, with the exception of if you, if you forget your password, and then obviously you need to reset your account. That, of course, you will receive an email from us because we need to provide you with the next steps. Password, obviously we can create just a fake password for the case of this. So with that, once you create an account, you'll go ahead and then be able to log in to the site. But for this, let's go ahead and get to the sign in section since I already do have an account. So type that in properly. All right, so I have my email address, my password in order to log in. And once again, that is under the sign in tab if you are already an existing user. Go ahead and sign in there. And this is what you are met with. So right away, immediately, you are met with welcome back. And then your full name and your last name, or the nickname that you've used to register with the account. And I always like that because I feel like it offers a personalized touch. And then you have your current goal. So if you would like, you can use this as a goal tracker of sorts, or information, especially on the day-to-day basis, if you want to create a little to-do list. I know that always helps me. So that's why we've integrated that as a feature. And on top of that, we also have a quote. I love starting my day out with a quote. I love seeing these quotes every time I log in. So these are all just inspirational quotes. So this one says, "You are never too old to set another goal or to dream a new dream." C.S. Lewis. So keep refreshing the page, keep logging in. You'll see new quotes, and hopefully they inspire you or they get you as excited, because I know I love them. Now, If we scroll, and remember, this is what we call the main dashboard. So the main dashboard allows you to really see all of the contents of the site and to toggle between them to really figure out where do you want to go, what information do you want to access, and so on and so forth. So here you can see that there's a section for financial support, a section for emotional support, and a section for social support. And this is all under the tab called resources. Next, we have content. Content, as we've called it, is a place where you can find information about how scleroderma manifests in the skin, the lungs, the heart and blood vessels, mental health, life changes, all of that information there. And this is all evidence-based and research-backed information as well. I mentioned before, we have a number of different content developers. We have members on our team who filter through all of that research. And these are, once again, students who are in the medical science program at Western, or medical students or science students altogether, filter through the information. And of course, we also had patient consultants review that information as well, so they can check it, see if it's vital, if it's important, and most importantly, if it's accurate as well. And we also have, like I said before, we have Dr. McLean, who is a principal investigator, who's a professor at Western University, who's looked through all this information, confirmed its accuracy, and given its final stamp of approval on all of that as well. So it's gone through a rigorous process to confirm that the information that is present there is accurate and is 100% research backed. So that's content. Now, if you bring your attention over here, you will also see some more information about ways you can toggle through the actual website. So here is the home, or the main dashboard, as we like to call it. Here is research. So this is new research that gets updated by either members on our team. We also have students at Western University contributing to this as well. So it's almost like news articles, but they're news articles uniquely about scleroderma as well. So we offer information about new research that's being published, and also as well, new clinical trials that are being conducted. What's the eligibility criteria? Where are they currently running out of? And all that information in this one-stop shop. So let's click, for example, this one, New Hope for Severe Scleroderma, a promising drug combination targets the heart and skin. So this was an article that was published by me back in July. And with this, we talk about a case study that was published a few days ago, I think it was around end of July, where there was a 25-year-old woman who had joint pain and Raynaud's phenomenon. And the doctors essentially tried out two drugs. They tried cyclophosphamide and tocilizumab. And with this, they saw an improved condition to severe scleroderma. So this is a case study. And with this, what you'll always find is that we always like to include a what's next section, where we highlight, why is this important to you? Why is this relevant? What does this mean for the broader field of research with scleroderma? And of course, what should patients know as well? So this treatment approach was used for a very specific and severe case. It's also a case study as well. So that means one individual was being tested with this. So this is not a standard therapy, but it is promising research that's being put out. Also, we put a disclaimer, and then you can also find the original article there. So all that information is being present or is being presented, and this is also information that is constantly being updated as well. So you'll see this one was June 25th, this is July 11th, then July 23rd. So we try to constantly update it at least bi-weekly. Now, that's research. Let's bring our attention to the forum section. Forums is interesting, and this is why I wanted to emphasize actually that this is where you go if you want to ask questions, find that community, but also on top of that, your name and your profile will show. So if you are comfortable with this, feel free to put your first and your last name. If you are not comfortable with this, feel free to put a nickname. So this is a question that I put out. It says, how do you find mobility aid services in your community? It was a little bit of a trial question. Hello all, I'm currently based in Mississauga. I'm looking for someone to assist with my everyday mobility activities. But you'll see that individuals do actually use this feature. They add to it and they respond as well. So keep this in mind. This is a place where you can go to ask questions. I know in speaking to patients, a lot of them mention that it's predominantly Facebook groups and things like that in order to find the community, but feel free to use this as well. This offers an excellent place to connect with others, to answer questions, and to really just find a place of community as well. Resources is next. So I talked before about financial, emotional, and social support. And I really want to highlight this because we actually had a student go through this whole process of regions in Alberta, Ontario, Saskatchewan, British Columbia, Quebec, wherever you are in Canada. What are the financial, emotional, and social support programs that exist in those communities? So let's bring our attention to Alberta. So Alberta, this includes Calgary, Edmonton, Lethbridge, Red Deer, St. Albert, and Grand Prairie, Alberta. And we have all this information here. So if you want, there is the St. Albert Food Bank, there's the Red Deer Polytechnic, Alberta Income Support. So that information is there. And if you want temporary rent assistance benefit, all of this, another thing that we really want to emphasize, has been confirmed and validated to be up and running. So in the process of gathering all this information, we've reached out to these organizations to ensure that they're currently recruiting individuals or that they're currently still offering support, since we do know that after COVID, a number of different organizations did have to shut down because of financial concerns or just simply due to lack of funding and support overall. So we've confirmed that these are operating, and you can access either the website, the phone number, the location in person, so if you need to visit them face to face, and then the specific region of Alberta that it's located, and then also a description about what kind of support they do offer. So feel free to look through this, find the region, and check to see what works best for you. And if you ever have additional ideas, or if you want to add in more information, please contact us. We're always eager to update this information. We'd love to hear from you. And yeah, we can always add that in, and we can confirm that they're running, and we can work towards creating those partnerships as well. Okay, so let's go to content now. So I talked before about how this is evidence-based information. So let's check out what that looks like. I'm very interested in the skin, so let's look at what that looks like. So skin. Interested in learning more about how the skin may be affected by scleroderma? Click here to listen to an audio recording and follow along using the text below. So we wanted to make this as interactive and as engaging as possible. So we know that people don't always like to just sit down and read hours and hours of content. So instead, what we have is we actually have an individual who went in and recorded the audio for each and every single one of these infographics. And it's done in a very engaging way. I've listened to these a number of different times in editing them, but also just they're fun, they're engaging, they're really interesting to listen to. So I encourage you to check that out. But if you are someone who likes more of a visual or reading sort of element, that is there for you. No need to press the audio. But you can see here, this is more information about how the skin affects or the skin is affected in scleroderma. And there's all that information there. One thing you will notice is if we bring our attention to actual skin changes and the images that are being presented, is we were informed by patients that oftentimes they really don't like seeing those medical and gory images that they would often see when they Googled information about scleroderma, especially on WebMD or any of those other resources. So we actually went ahead and created these images. So information about how the symptoms present, but using cartoon images instead. And overall, we had some pretty good feedback about this, but we'd always love to hear more about how you feel about this and whether this is a effective way of presenting that information, or if you would like some of the other information or some of the other images as well. So let us know. We'd love to hear back from you. But you can bring your attention to kind of all these different things. So there's mobility and growth changes, Raynaud's phenomenon, and then we break it down to also treatment and management. So we go through lifestyle modifications, some of the medications that currently exist, so whether it's immunosuppressive drugs or vasodilators, all of that information is presented there. We also have some creams, oils, and moisturizers. We know that typically individuals have a preference for what they like, but we recommend some general ones that are dermatologist approved, and other suggestions that are maybe more natural treatments that have shown evidence in literature or in science as well. So check this out, read through this, feel free to find that information or find that support, and we'd love to hear about what you think. But yeah, so that's content. And like I said, it's divided into all those different areas. So skin, lungs, heart and blood vessels, that information is there. Now, if we go to the settings section, what you will see is this is your profile. This is how you will be presented or what you'll see on ScleroCare. So say, for instance, you actually register with your first and your last name, but you decide maybe that's not the best for me and I want to change it to a nickname. You can. You definitely can. You can change that information there. You can also change your password here as well. And if you want, you can also link your social media to the actual ScleroCare website. We don't access the information that's presented on your social media at all. Instead, what we do is it's just a way for us to continue to allow for community building. So if on the forums, what would be on the forums, if you post it and you have your social media linked, so your Instagram, your X, your LinkedIn, your Meta, that information would become or would be shown if someone were to click on your profile. So that's something there to consider. We don't see what's on your social media. It's just a matter of connecting the two. So if you want to connect with other people, find that community, once again, that's there for you as well. Now, what's a medical resume? Let's bring our attention to this because this is always something that I find very interesting. But the medical resume was actually information that was suggested to us by a few patients where they said that they would love to find a way to basically summarize their health and their well-being prior to actually visiting a specialist or a doctor, because oftentimes those doctor's appointments can be very, very, very fast. And you might miss information or you might not be able to provide a full comprehensive description, I guess, of your health. So with this, what we've created is there's this medical resume where you can fill in these questions and you go in and you can answer. So what does an effective patient-provider relationship look like for you? Sit down and you answer those questions there. How do you feel best supported by your healthcare provider? What are some challenges you face in your everyday life? Have you tried any exercise regimens? What does a typical day of eating look like for you? What are some barriers you face that impact the usage? Just a couple of questions listed here. And you can answer these on your own time and fill in that information to the best of your ability. And afterwards, what actually can happen is you can export this and take this as a PDF. So this is a document that you will be able to have that is a full snapshot of your health. And you take this and you can provide this to your doctor, either through email or even have just a printed copy that can guide your discussions in real life. And we've also been working with physicians to get them on board to understand what this is, so that really it's something that almost becomes a standard or day-to-day in our discussions or in the discussions with the physician for that very first preliminary appointment. So feel free to use this. Another point as well that we really want to emphasize is that with this medical resume, this is not an item that is featured on your profile for public viewing. Not at all. This is something that is only accessible by you and only you. In terms of what I see on my end, obviously I have admin privileges. I've created this ScleroCare website. I do not see this at all. This data, this information is encrypted, is placed on secure servers. So that way, it is only you and your health that is being showcased to you. Now, in terms of that PDF, it is up to you who you want to share that with. We encourage you to be mindful. This is a PDF, so share it with your physicians and those who are involved in managing and taking care of your health, but that is entirely up to you about who you want to distribute that to. But in terms of the ScleroCare website, nobody else can see this, only you. All right, so that's the medical resume. And once again, that can be found under the settings tab. And there is two. So there's the profile, which is what people see. And then there's a medical resume, which is only what you see. So at this point, you might be asking, or you might be thinking to yourself, this is a lot of amazing information. I'm very excited to get started on ScleroCare. But what if I run into any issues? Or what if I'm struggling to gather some information, or I forgot where to find, say, for instance, the content section? Do not fret. Do not worry whatsoever. Under this, you can look at this little individual. So there's an icon over there. Click on that. And what you'll be able to see is that there is a chat feature where you can contact us and ask us questions directly. So this is a live chat feature. And you can say, hello, I am lost and I can't find the chat or the resources section. And you can also include attachments. And if you're more of an audio person, you can also send an audio message as well. If you want, you can also insert emojis if that's something that interests you. But then you can go ahead and you can send that. And then we'll then reply. Granted, I am filming this video, so I'm unable to reply to that message, but just know that you will receive a message as well, or you'll receive a response back. So this is something that we've created because we understand that navigating new technology, and especially navigating a new website, can be a little bit overwhelming, especially within the first couple of steps. So let us know, contact us, use this as a tool or a resource, because we would love to support you and offer you additional information and guidance. Now, that being said, you can also use the chat feature to contact us about additional suggestions or other information you would love to see on the ScleroCare website. If there's something that piques your interest, or if you'd like more information about it, put it here, put it in the chat section. We will indeed get back to you. Same goes for the emotional, financial, and social support. If you feel like there is a specific resource in your community that is not represented already on our website, contact us. Let us know. We'd love to hear from you. You can also look like you can play a game as you wait. So we'll just close that for the time being. But let us know, use the chat feature, and we'd love to get into contact. We would love to hear more about your experience overall and work on improving the site altogether. Now, this concludes really the bulk of the ScleroCare web application, or the website. And as you know, like I mentioned quite a few times, this is a free website, no strings attached, no advertisements, nothing. And that's because we are graciously funded by Scleroderma Canada, Scleroderma Society of Ontario, and Scleroderma Saskatchewan. So lots of the organizations have come together to provide us with funding and with guidance and support. So please, please, please contact us. Let us know if there's anything that you would like to see on the website, what information you'd love to see come to life. You can also find us on social media as well. We're on all the different platforms. So we're on Facebook at Scleroderma, or excuse me, at ScleroCare Canada. We're also on Instagram at ScleroCare, TikTok at ScleroCare. All of that is the same all throughout. So at ScleroCare, find us, connect with us, and join us on this journey as we continue to update, expand, and develop this website so that it becomes the best possible thing in the centralized hub, as I said before, of information for you, for your families, for your caregivers, to strengthen the research and the information that is available out there on Scleroderma. That's everything in terms of this information, or this webinar, or this walkthrough, as I like to call it. If there is anything, once again, my name is Amel. Feel free to contact me. You can also reach out to us by email if that's something that you'd like, at info@sclerocare.ca, and it should be hopefully on the screen. So info@sclerocare.ca. If not, connect with the individuals at Scleroderma Manitoba. They'll forward us that information to us, and we'll be able to stay in touch and stay connected. Thank you so much. It's been an absolute pleasure walking you through this, and most importantly, creating the application, working with our team to develop this. We look forward to having you on the site, becoming a user, and yeah, thank you so much.